The routine vaccine been administered since 1978 in Liberia. Pregnant women and babies' mothers are reluctant to take the vaccine with fear from the Ebola vaccine trial. The Deputy Program Manager expanded program on immunization. Adelphus Clark told us more.
We had communication clash. I think our initial thought was that the EVD trial would have been launched far before our exercise, but unfortunately I think there was some postponement, and that postponement led to the two activities happening at the same time. I think that due to the EVD situation, there are a huge number of children unvaccinated, and so we need to do everything humanly possible to ensure that those children are vaccinated. So we are counting on parents to make them available to us, because if you had them, the disease may haunt them. We are not saying that this is what we wish for, but we don't know the current situation. Like in Maryland, we're having pertussis cases there. About 200 children are already down with the disease. We don't know what will happen in other counties. So we are encouraging parents to make sure that the child or children receive the vaccination. The immunization, the routine immunization services are ongoing. The vaccines we are providing are vaccines that we've been providing since 1978. And we don't want our brothers, we don't want our sisters, we don't want our cousins, nieces, relatives to come down with diseases that we can prevent at no cost. The activity planned for in April are mass vaccination. Routine immunization is what happens every day in every health facilities across the 15 counties. So within our database, we have a total of 527 of those health facilities providing immunization services, routine immunization services. The April round are what we call mass vaccination, where we are targeting 1,125,000 plus. We are troubled owing to the fact.
Mr. Clark explained to RX Situation Room reporters the next steps.
What we are trying to do, we are using all of the local structures available to us. In addition to engaging the community, we are trying to do active community engagement, because we know that changing behavior is now a one-day thing, and we see that refusal or non-compliance is more like a behavior thing, and in order to change that, we need to engage the community more closely. So this is why we are planning to engage all of the communities across the 15 counties as soon as possible.
But the Deputy Program Manager expanded program on immunization noted that the Ebola vaccine is a trial vaccine that is based on consent and given to 18 years and above, indicating that the routine vaccine is targeting children less than 1 year. He explains further.
They are all routine vaccines. Like I said, we are targeting 10 diseases. BCG is used for tuberculosis, measles is used for measles, penta is used for 5 diseases, namely diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza type B. The PCV vaccine that we call pneumococcal conjugate vaccine is used for pneumonia, and then the yellow fever vaccine is used for yellow fever. We are hoping sometime this year to introduce the rotavirus vaccine for diarrhea caused by rotaviruses, and then we will be introducing the human papilloma vaccine virus in Bong and Nima County for diseases for cervical cancer. The current data available to us show that the people who are coming down with the disease are from 1 year to 10 years, but a greater portion of that number are in the age group less than 5 years. So we thought to target children from 6 months to under 10 years, since those are the two highest groups coming down with the disease.
Mr. Adelphus Clark speaking to RX Situation Room reporters in an exclusive interview at the Information Ministry. At the same time, Madam Patricia Parker, a vaccinator at the Soniwen Community Clinic, told us about her experience.
I said because of the Ebola crisis now, we don't have much babies, mother coming for vaccine. Sometimes I deal with maybe 25, sometimes 20, sometimes maybe 3 or 4. Like some do come, who's supposed to bring their babies for the vaccine, like to say in September, like the way how the Ebola started in August nearly now. When they come, like yesterday, I asked 2 mothers why they have delayed the vaccine, and they will usually tell me, or they told me yesterday that because the Ebola caused them not to bring their babies for vaccine. The TT now, that is the non-pregnant women, the pregnant women, and TT vaccine they give the prevention from tetanus. Their total, the more against last month now, I have 232 total, both the pregnant and the non-pregnant. Then the BCG, that is the first vaccine for the babies after birth. 65. That was the total for January. Okay. Up to maybe 190, 80. But now because of the crisis, they have dropped.
Meanwhile, some baby mothers, including Felicia Maud, Fatoumata Kaba, and Josephine Sumo, residents of the Soniwen community, were caught up with our microphone.
Ebola 1 year, farm, say so they miss off us. The hospital people pass around. They say more carry our children. They are carrying yes. The fasting, the importing to the children, so we are carrying yesterday. And the second side also 1 year, 4 months. They are no a good for care. They saw me pass.
How many months?
2 more. Then give me a 2 times. Yeah, good for my baby.
What made you?
Because my care alright. Now before more, I feel my fasting the same Copa, July. I take a planet and get a card for the holiday. I tell the people that fast.
This report is versed and produced with support from RX USA sponsor program. Reporting for Situation Room, Akoi Baysah, ELUM News.